this is Mahshid. Welcome to TebMedTourism. In this video, we are going to talk about surrogacy in Islam. Surrogacy is a reproductive assistance technique in which a woman surrogate carries a pregnancy for an infertile couple and then delivers the baby to the infertile couple. In different countries, there are different legal, religious, and social attitudes toward surrogacy. In Islam, there are also different perspectives on these techniques. In Sunni Islam, the majority of scholars do not have a positive view of IVF and surrogacy. They believe that taking sperm or eggs from a third party is like sharing a marriage bed with someone else, and therefore they comparing it to adultery. In addition, they argue that since the biological mother plays a genetic role in creating the child, there is higher risk of emotional and legal conflict between two mothers. However, two conditions are permissible in Sunni Islam as long as wife and husband are still married. Fertilization outside the body, which occurs by combining the husband's sperm and the wife's egg and then transferring them to the wife's womb. It means IVF. Fertilization inside the wife's body by mechanically transferring the husband's sperm into her womb. IUI. The above conditions means that there is literally no surrogate mother. The husband and the wife must be willing to participate in the process. The doctor should be a woman and, if it is possible, a Muslim. Surrogacy in the Hanafi school and surrogacy in the Shafei school are acceptable using modern assisted reproductive techniques as long as fertilization is done by husband's sperm and the wife's eggs. It is worth mentioning that a few religious figures allow surrogacy between spouses, two legal wives of one man. While traditional surrogacy might be prohibited, it's important to acknowledge the emotional pain and longing experienced by couples struggling with infertility. For some families, especially those with complex medical conditions or genetic issues, even permissible techniques like IVF might not be a viable option. In such cases, surrogacy might present the only hope for building their dream family. While acknowledging the religious concerns, it's crucial to have open and nuanced discussions about the individual realities faced by couples. This doesn't imply advocating for a change in religious rulings, but rather emphasizes the need for empathy and understanding towards the complex situations families navigate in their pursuit of parenthood. Significant difference in the perspectives of Sunnis and Shias on surrogacy in Islam stems from their different understanding of the act of adultery. In the Shia view, adultery is physical and bodily contact and does not only include the transfer of a number of cells. Also, from the Shia perspective, adultery destroys the family, while the donation of the sperms or surrogacy protects it. Surrogacy is acceptable based on the goals of Sharia, which is to protect the dignity and honor of the individual. It also defends the preservation of the human species, which is one of the main goals of Sharia. Proponents of surrogacy in Islam justify it by comparing it to wet nurse. Just like a stepmother who breastfeeds and feeds the child. In surrogacy, the child is also fed by the surrogate mother. Therefore, they consider surrogacy and wet nursing to be similar to each other. In the end, the Islamic ruling on surrogacy is still not definitively determined. This ruling differs due to differences of opinion between Sunni and Shia scholars. Currently, this decision is up to infertile couples who must decide whether to use this method in consultation with a doctor and a religious specialist.